everyone. Welcome to the second to last regional snapshot of 2022. Today with us is Jake Kornacki from Coconino County Health and Human Services, who is going to present on public health in the city and the county, especially related to the built environment. Go ahead and advance the slide. We are almost to the last webinar in this series. This is 21 of 22. And I want to thank everyone who's been along for the ride so far. All the webinars, both this week's and next week's and all the past ones, will continue to be available at our website, flagstaff.ez.gov/regional plan 2045. There's also a playlist on the City of Flagstaff's YouTube channel. And as these are very exciting topics, we'll continue to be producing white papers on them. And always welcome to your comments and thoughts on any of these topics, especially because as we're working on this plan over the next 2 years, things will change. That's how plans work. And so with that, I will hand it back over to Jake to share his expertise with us.
Hey everyone, this is Jake Kornacki, epidemiologist with Coconino County Health and Human Services. And I'm here to discuss the Flagstaff Regional Plan 2045 and how it relates to public health. I'm going to turn my video off while I'm presenting, but once we get to the Q&A at the end, I'll pop back on. Our built environment can have a direct impact on our health. Roadways help us get from point A to point B. They also expose us to hazards like poor air quality and traffic accidents. Playground and parks provide us space to be active, but poor design can put us at risk of injury. And stormwater infrastructure can help save property in the event of a flood, but poor planning can expose communities to disease by providing breeding grounds to vector transmitters like mosquitoes. So how we design and build our community can improve health and save lives. So Flagstaff Regional Plan 2045 aims to put a greater emphasis in public health. So how do we build a city that provides a safe, healthy environment for residents and visitors? In this presentation, we'll consider the following issues related to the regional plan and how they impact public health. So transportation, affordable housing, and climate change. So first, we can look at some data related to transportation and how it relates to public health in the county and city of Flagstaff. So motor vehicle accidents are a significant contributor to injury and death in Coconino County, and motor vehicle accidents are consistently in the top 10 causes of death. In 2020, we saw a drop in motor vehicle accident deaths. However, it was mostly due to the decrease in traffic from non-residents. Deaths among residents remain steady. So you can see the blue portion of those bars has remained pretty steady over time, whereas you see a drop in the orange portion. And additionally, the issue of motor vehicle accident deaths go beyond infrastructure because about 1 in 4 motor vehicle accident deaths among residents is alcohol related. Looking at motor vehicle accident hospitalizations, we typically see over 1,500 a year in the county hospitalizations related to motor vehicle accidents. And about 1/3 of those are among Flagstaff residents. And it's interesting to note that in 2020, again, there was a sharp decrease in motor vehicle accident hospitalizations. Again, less people out traveling due to the pandemic. But as you saw before, deaths among residents due to motor vehicle accidents remain steady. So an indicator that while there were fewer accidents, those accidents were just, or if not even more deadly than previous years. And then looking at, well, another consideration is the safety of those who wish to take alternative forms of transportation around the city of Flagstaff. So between 2016 and 2020, we saw a steady drop in the number of cyclists versus automobile hospitalizations. And 2/3 of these hospitalizations were Flagstaff residents. And while the drop in hospitalizations is a good indicator, a good sign, it would also be helpful to look at trends in the number of accidents reported to law enforcement to see if our roadways have become safer. And something that came to my mind is it would be interesting to look at who are the ones striking cyclists with automobiles. Are they residents who would more likely be familiar with the local bike infrastructure, or are they from out of town and unfamiliar with our roadways? And I think this information would be useful for how we design our roadways and communicate with the public to ensure cyclist safety. And then for the last bit on transportation, this is a heat map showing areas in the city that have more vehicle and cyclist crashes. So hotspots for vehicle crashes in the city are stretched out along the major roadways through the city and correlate with the roadways that see the most traffic. So along Route 66 on the east side, all the way into the center part of town on Butler, and then a dense concentration along Milton, especially through downtown. And hotspots for cyclist crashes are more densely located, and that's the figure on the right, that they're more correlated with where we see a lot of the pedestrian cyclist foot traffic, so downtown and around NAU campus. And being able to visualize where the danger zones exist for drivers and cyclists helps us identify areas where we can improve our infrastructure to make travel safer for all. Next, I want to talk about housing and its relationship with health. And the data that the county receives, it's difficult to draw direct relationships between a person's living situation and their health outcomes. But there's a large body of research that exists related to this topic. And a lot of this research suggests that quality, affordable housing improves health in a number of ways. So one way is that affordable housing makes money available for food and healthcare. So a study showed that low-income households that spent more than half their income on housing costs spent less on food and healthcare compared to similar households spending 30% or less of their income on housing. Another is that stable housing reduces stress and improves mental health. So studies have found that homeless children are more vulnerable to mental health problems, developmental delays, poor cognitive outcomes, and depression than children who are stably housed. Children without stable housing were more likely to use emergency department services because of a lack of regular healthcare provider. And difficulty keeping up with utility bills, mortgage payments, home repairs may be linked to lower mental health well-being and more intensive use of medical services among men. Poor quality housing can have harmful environmental exposures. So low-income families are more likely to live in homes that have a lead-based paint hazard than high-income families. And stable housing allows access to stable and consistent healthcare. So individuals living with chronic disease, it increases their rate for medical care and to maintain their treatment regimens and achieve better health outcomes. And then looking at affordable housing, it can prevent infectious disease through reduced crowding. So as we saw with COVID-19, crowded congregate living settings provided an environment for the virus to spread rapidly and make its way through the community. So through reduced crowding, controlling infectious disease is more manageable. And the last topic I want to discuss is the impact climate change is having and will have on our community. So as we see temperatures increase around the globe, there are numerous implications for public health. And as we go forward with planning how Flagstaff will grow and develop, as well as the county, it's important to consider how a changing climate in the area and the region will affect our residents' health. So the first bit is looking at temperature extremes, and we'll see these. We see these throughout the year, and as the climate increases and gets warmer, we see longer extended warm seasons followed by intense cold snaps. So on the left here, we have a graph showing trends in heat-related illness hospitalizations, and on the right is cold-related illness hospitalizations. So the graph on the left shows heat-related illness hospitalizations, which increase in late spring and peaks in midsummer, and the majority of heat-related illness hospitalizations are among non-residents. The graph on the right shows cold-related illness hospitalizations, which increase in the fall and peaks in the winter. And the majority of cold-related illness hospitalizations are among residents. Is there? Oh, sorry.
Someone joining us a little late. Go on ahead.
Sorry about that. So one population that is at greater risk of death from cold-related illness is the homeless population. And recently there have been deaths reported among the homeless that are associated with the first intense cold snap of the year. So we need to consider how we develop our infrastructure to prevent heat and cold-related illness, to provide shelter to those without homes, and alert residents and also visitors when they should take precaution outside. So when to damp down their exertion, when to hydrate, and keep themselves safe out in the elements. Next, along with temperature extremes, we should also be aware of the precipitation extremes resulting in either drought or flooding. As many of you are aware, precipitation up here seems like it's either feast or famine. Heavy rainfall and floods can contaminate drinking water if infrastructure is old or poorly designed, and floodwaters can also be a breeding ground for vectors that transmit disease like mosquitoes. And this past year was a pretty good example of that. So looking at vector-borne illnesses, especially with last summer's intense monsoon rain, especially down in the Phoenix, Maricopa area, we saw a huge increase in the number of West Nile virus cases reported in Arizona. And while we didn't have any in Coconino County, as things get warmer, if we do have an intense monsoon season, it's not outside of the realm of possibility that we could see a spike in West Nile virus cases up here as well. And on the flip side of heavy rains and flooding is drought and wildfires, a scenario we are currently experiencing. And along with the burden of managing displaced populations who lose their homes in these fires, there are acute health impacts related to exposure to fire and smoke. So the graphs below show hospitalizations related to fire and smoke exposure. The graph on the left is for the year 2021. And you see a spike in June related to the active June wildfire season that we had. And then the graph on the, that was the graph on the left. The graph on the right is the month leading up to the tunnel fire, where we see a big spike in, or a relatively big spike in hospitalizations related to fire and smoke exposure among people evacuating the affected area. We don't see huge numbers, but when you go from 0 to 7 or 0 to 3, it's quite noticeable. And finally, just some things that I've been thinking about and curious about when it comes to planning for Flagstaff and Coconino County's future and how it relates to public health. So how do we plan for and accommodate a growing population? So the idea of one is density versus sprawl. I don't have the answers to any of these things, but just some pros and cons that I see are, density isn't the same as crowding. When I think of density, it's everyone has their own space, whereas a lot of times I think people confuse density for crowding. And crowding is something that, as I mentioned earlier, allows for infectious disease to spread throughout a community. And with density, it's easier to allocate resources and have quicker response to an event of an emergency. But then you have a more congested urban area, can have environmental degradation, poor air quality, things like that. And also, how do we provide safe and reliable transportation if we do decide to sprawl out? How do we connect these outlying communities with the urban areas so that they can come to and from in a safe and reliable manner? And also, again, we're currently going through this, but how do we house and care for displaced populations due to climate change? With wildfires going on right now, a lot of people have lost their homes. And how do we quickly accommodate for those people? And then what if, in the grand scheme of a larger situation where people are displaced from areas where there's just extreme heat and end up coming up here to escape that heat in mass? How do we handle those changes in shifts in population? So yeah, and there's a lot more to think about and consider, and I'm sure everyone both at the county side and the city side are also thinking about these things as well. So that's all I have. So thank you so much for tuning in. And if you have any questions, I will try my best to answer.
If there are questions, you can either let us know by raising your hand using the reactions button, or you can type into the chat that you have a question you'd like to ask. Jake's going to stop sharing his screen, and then we'll ask that if you have questions, you unmute and turn your camera on if you would like. So, Nat, you've got your camera on. Do you have questions?
Yeah, now I have my hand up, but I'll put it down now. Yeah, I have this. First of all, I'd like to thank Jake for obviously putting some time into this report and organizing it. Really appreciate that. A general comment, I think in this regional plan, the ongoing and quite predictable effects of climate change has to be a kind of a veil that covers everything, because each regional plan, we have the regular things like traffic and how to develop here and there, and all of the ideas that the community has in their image of Flagstaff. But I think there's no, and those are year after year, we have those. But what is different now is, I think, as you pointed out, the change that climate change will have on the effect of not only our immediate planning, but just thinking in the long term. And I'm not talking about things, how do we try to slow it down? Those are all important too, but in terms of regional plan, it's addressing what's going to happen. And you mentioned something that I thought was really got me thinking just at this minute about the migration from the south. There's going to be an early migration that's kind of economically driven. The early demographics of that might be, more second homes and more places to come up, the people that can afford that, with the idea that, hey, if it gets real too hard, I'll just work from home up in Flagstaff, or that kind of thing. But that would then be followed by, and maybe the canary in the coal mine for that is the number of homeless people that come up in the summer, and because it's always been too hot in the summer down there. But really, my feeling is they've come up because it's more comfortable up here. Well, the change might be, it's not only uncomfortable down there, it's dangerous down there. So increasing the number of homeless, and then the whole spectrum between that and the more affluent folks that buy their second homes up there. That's all I think going to happen within this planning time, at least the beginning symptoms of it. So I've rattled on enough. I have several other questions, but I'll be quiet for a moment. Thank you.
Yeah, thank you for that. And yeah, that's you know, things I've been thinking about too. Especially, and I know people are thinking about it at the county as well. Especially, you know, our emergency response group. Obviously, they're incredibly busy right now. But yeah, as a county, because how do we also address that and provide services in the event of, you know, mass migration?
Hi there. I thank you so much for presenting today. I came in a little bit kind of halfway through the presentation, so I missed a little bit, but I guess I just want to say kudos to you guys for discussing the public health implications, you know, with the walking and the climate change, and it's so important, like from a parks and recreation perspective, when we think about having parks that are available and nearby to people, but if there's not a safe way they can get there, that affects their public health, of course, as a way too. So anyway, I just really appreciate you giving this thought and doing the presentation. Thank you.
Liz, that's a really good point. I know that when we did the parks and open space, we talked a little bit about that we've done some access analysis of our parks and open space, of if they are available by transit and if they're available with walking and biking in terms of being accessible. And some of the reasons that's important is not just public health, but also just overall access to well-being, access to opportunities to be active. The way we build streets can also decide if they're active spaces or if they're spaces where people who are not in vehicles feel that they cannot use or take advantage of those spaces. You know, there's an article that came out just this week that said, if you think of it as children and vulnerable people on the road and cars are in opposition. And so there may have to have a public health mindset about transportation, a really different look at how we organize streets. And also that can serve both public health and equity when we look at those things together. I actually think equity and public health, equity we're talking about next week, have a huge overlap, and that's kind of why we group them together. Is there's a lot of discussion across the US of having health in all policies, and likewise having equity in all policies, because they have a lot of things in common in how, when we think about the world through those two lenses, we might end up making decisions a little differently. And I think we've all learned in the last 3 or 4 years how important those conversations are to our community.
Thank you.
Matt, what else do you have?
Yes, Jake, one suggestion on the 2 graphs that indicated or graphed the hospital cold or heat related problems. It'd be nice to have those graphs on exactly the same scale so that you could look to say, is the heat getting worse more than the cold, or that kind of thing. One scale went from 0 to 25 and the other went from 0 to 20. So that's just a
Yeah, thanks for pointing that out. I just kind of put these together.
no,
Yeah,
it's great. And I think that comparison would be easier that way, but I think it's important too. If we're getting more and more heat and less cold, it's also an indication of the changing climate.
Yeah, and it's interesting because we're within the past couple of years, we've just started to get access to some of these data systems that are more in real time as to like when we're seeing these spikes in, you know, heat exposure or cold exposure. And it would be really cool to eventually develop, you know, some sort of modeling or whatever to say, you know, when we have a spike in temperature, you know, by X number of degrees, like what kind of increase in hospitalizations related to that do we get?
Yeah.
So still probably don't quite have enough data at this point, given the news sources that we're getting, but it's long-term plan.
Yeah, no, that's great. Data is great. Speaking of data, you gave the Nile,
The West Nile virus.
the West Nile virus statistics for Arizona. Have there ever been any in Flagstaff?
Historically, not. I don't know off the top of my head. I know they find so birds are the reservoir for West Nile virus, and the county environmental health, and I think they also partner with researchers at NAU. They go out and do bird surveys, and they find the virus in the birds in the region, but it hasn't led to a spike in cases in humans yet. But it's something we do surveillance of.
So you say it exists in the birds up here, but it's not being transmitted to folks yet?
Not that we have seen.
Yeah. I'll just throw in one other quick question. The traffic statistics, the injuries, that's all within the planning area, right?
So that was for the deaths was by county, just the number of motor vehicle accident deaths in the county, and then hospitalizations. I split it out between Flagstaff residents. We don't have the data in our hospitalization records as to where the accident occurred. So it could have been a Flagstaff resident getting in a traffic accident up at Page. So this would be good information to combine with like the law enforcement data that is getting the traffic accidents that are reported to them, and kind of combine to see what is the rate of accidents happening in Flagstaff that results in some sort of injury or some sort of death, and kind of merging those resources to get a better look at that.
Yeah, that's good, because I was interested in the numbers, but I wasn't sure what they applied to.
Yeah, so those are at the county level.
Yeah, okay.
Jake, how much of the data in public health, when we talk about births and hospitalization and deaths, are influenced by the fact that Flagstaff has the hospital for a very large geographic area? Like, for instance, when I go to the State Department of Health Services and I pull the vital statistics, they tell me how many births are in Flagstaff, but the parents of that kid that was born in Flagstaff may or may not live in Flagstaff. How much of that do we see in our data? Because we always have we have a definition for Flagstaff of the Flagstaff region being sort of these areas right around our community. But when it comes to health, we are actually a health asset for a much larger geographic area.
Yeah, so especially for vital statistics, like our deaths and births, that information we get. So for example, deaths, we get death certificate data for all deaths that occur within Coconino County, regardless of whether they're a resident or not. And then we also get all death certificates for Coconino County residents that occur outside the county. So it kind of gives us this bigger picture of what's happening within our geographic boundary, and then also our residents, if they're going out somewhere and something unfortunate happens to them, we also get that information. And it's the same thing with hospitalizations. You're right, FMC is huge. Like people are coming from all over the region for treatment at FMC. So right, those visits are included, and then we can tease out, okay, which ones are just among residents and which ones are these people coming from outside places seeking treatment. So it takes some work to tease through all of it, but it's possible, and that's how we do a lot of our analyses.
That was a really good clarification of how you can see a number on a website and it can mean something just a little different than when you have someone like Jake, who's an expert at looking at this information, who can comb through it and share it a little differently. So we're at 12:30. I want to thank everyone for participating, and I'm going to stop recording.